This is Dr. Claudia Martorell. I am an infectious disease specialist, and I'm going to be talking about what I think is an important topic in healthcare, which is sexual well-being or sexual health. And I will include some information about sexually transmitted infections, including HIV. And why is this topic important? Well, you know what? Sexual health is part of sexual wellness. It's part of mental health. It's part of someone having family and friends, finances, housings, hobbies. So it is important to address in a safe manner. And when you are negotiating sexual activity with your new partner, you have to think about, and that partner has to think about respect, freedom from feeling safe, and of course, getting tested for sexually transmitted infections to include HIV, and knowledge about not only pregnancy but also sexually transmitted infections. Sexually transmitted infections can happen to anyone at any age. Society feels that it's certain group of people, certain social economic classes, certain ages, but the truth is that younger people and older people can acquire sexually transmitted infections and HIV. 1 out of 5 people in the United States has or have had a sexually transmitted infection. And when you think about women, about 27% of people or women with HIV infection are between the ages of 25 and 34, and about 24% of women with HIV in the United States are between the ages of 35 and 44. So it's important, again, to be aware of it, get tested, and get treated. Sexually transmitted infections, there are many. There are bacteria, parasites, viruses, others. So if you think about bacteria, some of the examples include gonorrhea, chlamydia, syphilis. If you think about parasites, trichomonas, and then pubic lice or scabies. Viruses include HIV infection, hepatitis C infection, hepatitis B, human papilloma virus or HPV, and then herpes viruses, particular genital herpes or HSV. Many of these infections, and most of the time, the person will have no idea that they have an infection because they have no symptoms at all. However, some people will present with certain symptoms, and if there is any exposures or concerns, it should be discussed with the primary care provider or an infection specialist. HIV. So human immunodeficiency virus is a virus that attacks the immune system. It is a lifelong condition. It has no cure. There is research looking into cure, but right now the medications suppress the virus. This is one particular infection that can be prevented, not only through condom use, but there are medications specifically prescribed to prevent HIV in the setting of an exposure or potential exposure. HIV, how can it be transmitted? There is a lot of misinformation about HIV transmission. So HIV can be transmitted through blood, through semen, vaginal fluids, rectal fluids, breast milk. HIV cannot be transmitted through sweat, saliva or spit, tears, air, shaking hands, touching the person, using the bathroom, hugging, sharing dishes, silverware, kissing. It cannot be transmitted through mosquitoes nor ticks. There are some other infections that could be transmitted that way, but HIV is not one of them. So when to get tested for sexually transmitted infections, including HIV? For HIV, the CDC recommends testing at least once in everyone's lifetime. And this includes teenagers and it includes older people. But in general, some people may need to be tested more than once, right? If the person is using substances, if the person has one or more sexual partners, or the person may suspect that the sexual partner is using substances or is engaging in sexual activity with someone else. If the person has had a sexually transmitted infection, that is an indication for HIV testing, and also a recommendation for PrEP. And I'll go over that, what that means very soon. And when can people get tested? Whenever it's needed, and whenever there is a potential exposure. So the only way of knowing if the person has HIV infection is by getting treated. And there is rapid tests and there is blood tests. Right now, even through telehealth or telemedicine, a person can get a prescription for testing, or they can go to a pharmacy to get the testing kits as well for HIV and other infections as well. So many options. In terms of getting protected against sexually transmitted diseases, know your sexual history, discuss or negotiate protection with your partners, including the use of condoms. And just be aware that if you or your partner is not willing to use condoms, for HIV prevention, there is PrEP. So what is PrEP? PrEP is pre-exposure prophylaxis. And that is a type of medicine that reduces the chances of getting HIV from sex or injection drug use. When this medicine is taken correctly, it is 99% effective in prevention of HIV transmission. PrEP can be a pill, like for example, Truvada or Descovy, or it can be prescribed as an injection, like for example, cabotegravir or Apretude. The condom use should still be used, and the reason for that is that these medicines that I just mentioned prevent HIV infection, but will not prevent other sexually transmitted infections. There is also doxypep. Doxycycline is an antibiotic that we use to treat multiple infections, including some sexually transmitted infections. So if someone knows that they will be exposed or they will have sexual activity with someone that they don't know well, and they may be worried about getting an infectious disease that is sexually transmitted, they can go on doxycycline, and there is very particular instructions on how to use it. So if that is something that you're interested, just talk to your provider about it. The same with PrEP. PrEP, in theory, needs to be taken daily if it's an oral regimen. If it is an injection, it is every other month or every 2 months. One of the PrEP medications, Truvada, has an indication for on-demand PrEP, meaning that if the person is not sexually active and has not been sexually active for a long time, and then all of a sudden it will happen or it happens, they can take that medicine for a few days to prevent active HIV infection. I think it is important to mention PEP because it is a term that gets confused. PrEP is pre-exposure prophylaxis to prevent HIV transmission. PEP is post-exposure prophylaxis. That means that the person already got exposed to HIV or thinks may have had an exposure and will need a 3-drug regimen or a medication for 28 days to prevent acquiring HIV after that potential exposure. It could be a needle stick in a office setting or hospital setting, but it could be also to avoid sexual transmission after an unwanted or an unplanned sexual activity. There may be concerns about PrEP and side effects. Every medication, including Tylenol, may have side effects, but what I feel is that if there is any concerns about it, just discuss it with your primary care or infectious disease specialist. Health insurances, most of them do cover for PrEP and PEP and doxypep. So remember, talk to your partner, negotiate, establish your rules, the importance of condom use. If not, PrEP is an alternative, or the use of both. And also talk to your primary care provider or specialist to go over these indications and see which one is the best option for you. Thank you so much for joining me. I hope you liked this content and that it was helpful and that you learned something out of it. And